Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of obstetrics is infections acquired in pregnancy. We divided our lecture into 5 sections. In the first section, we will talk about the perinatal infections, and in this, we will cover the rubella, syphilis, and toxoplasmosis. In the second section, we will talk about cytomegalovirus and chicken pox. What are the causative agents of these infections, cytomegalovirus and chicken pox? What are the effects of these two conditions on pregnancy and fetus, and how these can be managed? Then in the third section, we will talk about some other congenital infections like parvovirus infection, listeria, and malaria. Then in the fourth section, we will talk about the infections acquired during delivery, like herpes infection, group B streptococcus, and chlamydia and gonorrhea. Then in the fifth and final section, we will talk about the HIV, human immunodeficiency virus, and what are the effects of disease on pregnancy, effect of pregnancy on the disease, and how it can be treated and managed. So very, very important topic. So keep watching sqadia.com to learn about this topic.